Yeah, princess, yeah.
You see that
Thank God today.
yesterday? I think
Yeah,
I
I'm
think
just telling IJ, please make a comment at the comment section. Just make a comment there so I can bring you up.
they intentionally did with
Yeah,
they did with
yesterday
us
I
yesterday.
know they know what they were doing yesterday. They didn't want us to really
They
have it
slept with
yesterday.
us
So
yes. Honestly. Okay, look at this one. It didn't even take a second.
I'm telling you, I'm just trying to. Yeah, I've seen her. All right, I'm sending her an invite too, so she can join us at once. So there is no time to waste. Yeah, she's joining us. All right, I sent you an invite, IJ. Just accept it so you can come up live here. I wouldn't want it to be like, yeah, she's here. Yeah, she's here. Hi,
Hello.
how
Hello,
are you?
I'm fine.
Good
Hi.
morning.
You're
Yeah,
welcome.
yeah, it's evening.
You're welcome today.
And
Today this is evening. This is evening here. This is
Yeah,
7:14 here.
and
Um,
it's
and that
11:15.
should be 4:14 there in Nigeria, right?
It's
Yeah,
11
3 hours.
11
4:15 at
And in
11
night.
US, what time is it?
11:15.
Oh, 11:15. Okay. Our beautiful lady, Ijoma is just all I know about her. Tell us about yourself, please, before we start.
Okay, my name is Okafor Ijoma. I'm a registered nurse with Nigerian Nursing and Midwifery Council. I'm also a registered midwife.
Wow.
I'm a mother of three. I'm married and a mother of three as well.
Wow.
So,
Okay.
is there anything else you want to know apart
No,
from
no,
the
no. That's enough. That's enough CV. That's enough CV. All right. We invited her today, yesterday rather, but network, I would say network didn't allow us. And then she was really engaged with a lot of things yesterday, so she was not able to join us yesterday. So myself and Princess, we scratched the surface of what you are about to talk today. So we thought, you see, I am not in my usual regalia.
Yeah, honestly, I'm just looking at it. I said, "Oh, today
So
is black."
I was actually, yeah, I was actually running off to get a few things, but I thought I should hold on for this. These are sacrifices we make
Yeah.
just to
Do you
keep
know? I
our
personally
order.
did not go to church because our church service started by 11. And when you
Mm,
said that, I was like, "Oh my goodness!" So I'm going to cancel going to church today because I know everything we do is the work of God. You
yeah,
don't
of
have to
course.
be the
This is
church.
evangelism, you know.
Yeah. So, Sister Joma, as you know, you already know my name. My name is Princess Chagoze Mopara. I'm from Nigeria. Actually, I'm a health worker. I live in the United States of America.
Okay.
So you get to know. And I'm from Imo State.
Yeah,
I'm from
So
Imo State as well. Nice to meet you.
nice to
I'm
meet you. So
from Imo State too.
you are highly welcome to this wonderful
Yeah,
program. And
we'll be having her for 2 weeks by the grace of God. That is, if things go down well. I discussed with her on how we can separate these issues or talks. So we had to segment them. So today, she'll be talking on because you cannot separate blood pressure from kidney. So we thought to marry these two together today. A lot of people have been dying out of will I say negligence,
out of
carelessness, and all
out
what
of
have
out
you
of ignorance.
as regards to kidney. We have seen a lot. We have heard a lot of cases
Hey,
that has to do with
good morning.
kidney and
Ezi
blood
is joining from
pressure.
the United
These are
States.
the two.
Good morning.
Ezine Ebere, right? You're
Ezi,
welcome.
yes,
You're welcome.
she's my
So
friend.
we want to talk about that today. We have a lot of things to talk about. We talked about kidney. We talked about heart failure. We talked about liver. We talked about prostate cancer, and we talked about blood pressure. And the last was
Diabetes.
diabetes. So we thought we should leave these other ones for next week and then talk about kidney and diabetes. Please, can you tell our audience what this kidney failure is all about. I mean, just
Let's
take the floor, please.
let's give her the platform, the floor to do justice. You're welcome.
I think you just made a mistake. You're going to talk about the heart, the high BP, then the kidney, and the kidney failure, not the
Yeah,
diabetes.
yeah. I said just some. I didn't want to start separating them. So take the floor to tell us how this one is. This one cannot be going without this other one. So blood pressure, heart, and then kidney failure.
Okay, which of them do you want me to start from?
Any
You
of
can
them you
start
want to
with
start
any
from,
of them.
please.
It's
We
your
are eager
floor.
to hear.
Okay, thank you for having me, and thank you for this opportunity. Okay, so first of all, we'll talk about the heart because we need to know actually what the heart is all
Your
about.
voice is
Then we cannot
low. I
talk.
don't know if it is from me.
Okay, can you hear me now?
Yeah, I can hear
I
you.
can hear you.
Okay, first of all, we have to talk about the heart. I don't know. The heart is a muscular organ, and the primary function of the heart is to pump blood and also to take blood to the lungs where it originated. That's where it gets oxygen. Then from there, it now take it to other vital organs and other parts of the body. Now, when we talk about high blood pressure, the primary function of the heart is just to pump the blood. So when you talk about high blood pressure, it's all about the pressure, the blood exert on the blood vessel walls. So now let's take for instance the best description of high blood pressure is, for instance, in a borehole where you have a hose and water is coming out from that hose. Can you hear me?
Yes.
Yeah, I can hear you.
Yeah, and water is coming out from that hose. There are different pressures according to how you regulate it from that hose. So when the pressure is too high, it's going to hurt that blood vessel very well. It won't be good for that blood vessel. Now, in the body system now, in our hearts, the blood pressure that we're supposed to maintain as humans is 120/80 at least.
Yeah.
Then according to who, because of they made some adjustments, then I said 140/90. Then anything above it, we categorize it as high blood pressure. Now, when this blood is so high, the pressure is so high, it affects the vital organs because all these organs are connected. They are connected through the vessels. The heart carries the blood and supply to the vessel that takes blood to the kidney. Now it supplies to the brain through the vessel as well. It supplies to every vital organs. For example, one of the things that can cause high blood pressure is sedentary lifestyle, such as smoking, poor diet. Poor diet doesn't mean you are not eating in large quantity or whatever. It means that your diet is either high in sodium, which is the primary cause of high blood pressure as well. High sodium diet is a very poor diet. So you make sure that you reduce your sodium. Then when for example, when there is high sodium diet, what does it do? Now, this sodium, the kidney, now I'm trying to explain the relationship between this high blood pressure and the kidney damage, the kidney failure. Now, when when there is high sodium diet, the kidney, it will disrupt the function of the kidney because the kidney regulates the sodium and water balance in the body. Now, when it disrupts it, it will make the sodium to be at a very high level in that kidney. So the kidney will not function well. And when the level is too high, when the sodium, the level is too high in that kidney, it will increase, it will send a signal that, oh, there is problem, and you see the heart will try to pump blood fast. So you see that because of that high rate of sodium in the kidney, that the kidney will not be able to, to balance and control. You see the person's blood pressure getting high. So first of all, let me talk about the risk factors now. Number one is this high level of sodium diet. High sodium diet. Second is obesity. Third is smoking. Fourth one is consumption of alcohols in a large quantity, in a very large quantity. Then the third one, the third one is when someone have a kidney disease, it disposes you to hypertension, because they work hand in hand. Now, what else am I going to say, about it?
Mhm.
Do you have any
Even,
question for
yeah,
me?
I know there are many anyway, many of factors that could contribute to having high BP. Okay, you've been
Yeah,
talking about high BP. What could make one have low BP, low blood pressure? Is there
there are so many.
anything, because I know there are, BP comes in two ways, low and high BP. I think so. I don't know if these are just the only ones but these are just the only things I hear. Having high BP and low BP.
Okay, there are so many factors that can cause low BP, but those factors are not as much as that of the high BP. Some are genetic, in their gene there is low BP. I have seen that in their gene. Some are alteration in the hormones, when there is an alteration in the hormones, and lots more. There are many of them. So, but today I think we are talking about the high BP, and we should focus on that.
Oh,
Yeah,
okay,
I
okay.
think why Obi asked that question, because yesterday somebody actually said, I hope you guys are going to talk about low
Low
BP. Yes.
BP, yeah.
Yeah, I think that was why he asked that question, because we cannot talk about high blood pressure without talking about low blood pressure. Two of them kills. So if
Yes,
your
two of
if
them.
your if your blood level is low, if you're having a low blood pressure, it kills. And what do you do to prevent low blood pressure? And what do you do to prevent high blood pressure?
Yeah, that comes
Okay.
to my question. Yes, now she asked it. Preventions to blood pressure. Let me not categorize high or low. Preventions to, because what causes them are synonymous in nature, if I should put it that way. Almost synonymous in
It
nature. So,
still have to
what
do with the dieting, like she said
exactly,
before.
Yeah.
exactly. So, how do we prevent having, because I don't want to say control. If you talk about control, we're talking about medicine, and you may not be allowed to be telling us about
Sister
medicine
Hope,
because of, yeah, I understand. So,
Good
how do
morning.
what are the preventive measures you think
Okay.
one
Number.
can use to prevent having BP? Or maybe say
Okay.
control measures, whichever way you want to use it.
Okay. Okay. The first one, like I said, is dieting. You have to control your salt intake. Low sodium diet. That's the main thing. You just have to be on low sodium diet. The second one is you have to be active. Lack of
Yeah.
exercise can dispose one to high blood pressure. The third one is you have to watch your weight. Be at a moderate weight, because obesity can cause high blood pressure. So you have to be on a moderate weight. The another one is lifestyle changing, such as doing away with smoking, stop smoking, stop taking alcohol. Another one is you remember this high BP, there is also genetic,
Yeah,
and
yeah, yeah.
the genetic type, you cannot control it through maybe lifestyle changing, or through reducing your salt intake. You cannot control it through that way. It's through medication. Do you understand?
Yeah.
issue medication, you take your medication, prescribed medication. Then another one is there is what is called pregnancy induced hypertension as well.
Okay,
Yes,
that's I'm going
Yeah.
to ask our question.
yes. So this pregnancy induced hypertension is when a woman is pregnant. Somebody that maybe some of them they normally have normal BP, but as soon as they are pregnant, their BP will skyrocket. So when you are having pregnancy induced hypertension, make sure you how to manage it, or how you can actually manage it at that stage, because most of them as soon as they give birth, the hypertension will stop. So you go to your antenatal and make sure you do whatever your gynecologist and cardiologist tell you. So now when it comes to low BP, depending on the cause, and I know that some medications do cause it. There are some medications that can cause low BP. It depending then when you're having low BP, the best thing to do is to visit a doctor so that they will be able to diagnose it and figure out what the cause is, and they will not advise you on what you should do to stop it. If it's because of medication, because our people here they are good at taking medication anyhow.
Self-medication, yes.
Yeah, they are good. That's
And
indiscriminate
abuse of
use of
drugs also.
medication. Yeah.
And that's
So if it's
what is
because
killing a lot of people,
Yeah,
because
exactly.
yes,
you you
so
cannot
if
just
it's
take medication.
yes, so if it's because of that medication, they'll ask you to stop it, or they can prescribe another one that will not have such adverse effects to your health. I don't
Okay.
know if you get me.
Yeah.
Then if it's due to hormone, and there are other disease conditions that can lead to that as well. So it depends on what the cause is. Then you will not be advised on what to do so that it should be normal again. I don't know if I
Okay.
make sense.
Okay, yeah. What when you talk now, you talk about low BP. What are the percentage of your blood level that will indicate that you're having a low blood pressure?
The low BP, okay, when your BP now is 90/50, in some hospital, some theory they say that it's still like within range. But when it's like 80/40, that's low BP. Anything below that is low
Like
BP.
with my own understanding as a healthcare working with so many people that have been sick for over 3 years now, I've been able to realize, because I've had a case of a person who has low blood pressure, and each time her blood pressure drops to 110 over 60 or over 70, we need to call a doctor. Or
Okay.
100 over 90, we need to call a doctor.
Are you sure the are you sure the machines are okay? Because here, even 80, 100, actually, 90, 100, and even 110 to 120, like that, they tell you is normal.
No,
Yeah.
I mean, it depends again, according to what I understand, because I'm not a nurse. A doctor was actually explaining to me. I was actually practically taking care of this woman. I do all the blood pressure shake
Checks.
up every morning. What they said to me is this: age matters in terms of blood pressure, and
Correct.
sex, that is being a man or a woman, actually matters. You understand me? So
Yeah.
that's what they made me understand. All right. So why taking the woman? Because anytime her blood pressure drops to 100 over 80, she will start feeling dizzy, that she might fall. So they need to, maybe to younger people, if it is that time, that of 100 or 90, you might actually carry yourself, but to an elderly person, the person might fall due to dizziness. So
And another thing, it depends on the health condition of that patient.
of the exactly.
Yeah, it depends because 100, 110/90, 110/80 is actually normal over here. I've seen patients with
Yeah, I
such
think
blood
age. I
pressure,
think
and
from what Princess was saying, I think age also contributes to, you
Yes.
know.
yes, age, yes, and
Because the woman is actually
they
aging, so I think age is actually part of it. So
Yeah.
now I like what you said about pregnancy-induced high blood pressure. And what if in a case whereby you have this pregnancy-induced blood pressure, and after you give birth and the blood pressure refuses to stop? What would you do to prevent it or to help yourself come out of the blood
yeah,
pressure?
when you put to bed and the blood pressure refuses to come down, that means you have become a hypertensive patient. So you have to start taking your drugs while you
Okay.
go. Yeah, you have to just start taking your drugs. Yeah, and but mostly about let me say 60 to 70% of women with that pregnancy-induced hypertension, when you interact with them, you find out that they were already hypertensive patients. Just that the thing triggered more. The
Like
pregnancy
me,
triggered it.
yeah, like what you say, like 50%. Like when I had my first child, I was early 20. I found out that I
Okay,
had the hypertension, but it
okay,
was pregnancy induced hypertension as of that time. Had my early, I
okay,
don't even know what is hypertension as of that time. So
okay,
going forward, after 8 years, I had another baby. Years ago, I had another baby. I was pregnant. I was still having the same hypertension. When I had my third child, I was still having the same hypertension. Then after my last child, it never stopped. It never
okay,
stopped. And when you're talking about sodium, high amount of sodium intake, I know it is the major contributor to high blood pressure. The
of
major
course,
contributor. That is
correct.
true. That is fact. But the truth is that most people, I think there are some, I don't know if it's from hormones, that if there are any hormones that produces sodium from the body that can trigger it. Because personally, me, I'm not a salty person, and I don't
Okay,
like too much spices, but I find out that I feel so now. How I do it now is, if I want to buy any food that is on can, I will try to read the label, because it's very important to read the label of the food you're buying to know the amount of sodium in that food.
Princess, if you can, avoid canned foods if you can, because these are
okay.
deadly. Very,
I
very
want
deadly and
to
dangerous. If
I
you
want
can.
to ask you
Can, can,
something. I want to
can
ask
I
you something.
avoid Maggie? I hope you know it's sodium, right? And every family in
That's
In
what I want
Nigeria
to.
eats
You could
Maggie.
you could actually no, you could actually,
That
do you know that there are Maggi that people are producing locally in, I mean, this local what's they call it? These ingredients that they produce locally in Nigeria. Maggi is a combination of, I think, on crayfish and all the rest of them put together and all that.
Piece of
Those things they can give you
but
natural Maggi without the cube itself. And these things I get them in large
Okay,
quantity whenever I travel home.
I mean, like me cooking in my house now, what I eat, I don't put Maggi now. What if I go outside, like I travel and I have to eat, because you
It's
have
a
to eat.
one-off, it's a one-off thing. I mean, it's not something
It's
regular.
not a one of it, because most times it's a travel, you're going to stay like 1 week, and you're not there with your pot. So what will you do? You will not eat.
It could manage. It could
okay.
manage. It will not kill
When
you.
So
when you
that's
say
where
that
I'm coming to.
Oh well.
okay, when you say you're not a salty person, I wanted to remind you that it's not only from salt that you get sodium. Just like you mentioned Maggie.
I know. That's
If you are
why I
eating
said
if you are eating Maggie, and most of the Maggie, when you see the sodium level is very high.
exactly.
The sodium
That's
in it
that's what I
is
wanted to
very,
say.
very
That's
high.
what I wanted to say. If you want to buy your Maggi or your spices, please try and check the sodium level. If the sodium level
Yeah,
is above 40, please just drop it. A cube of it can trigger your blood pressure if
of
you're
course.
hypertension patient. A cube of
Mm,
Of course.
Yeah, so you have to know the amount of sodium you put on your food, not only the real salt. The real salt, either the sea salt, is not even it's not even the problem. The problem comes from our spices, like those that eat noodles. That spices you put on that
exactly.
noodles has high level of sodium in it. So you
Sodium,
eating it,
exactly.
you are actually bringing that hypertension. So there are so many things we eat, we buy, we don't know they are salty. Even our carbonated drinks. Check,
Exactly.
read it very well.
Okay.
I stopped taking soda. I don't want to take soda again. So I
Ah,
stopped it
oh,
entirely.
you just stopped. You just stopped recently. Me that stopped since how many? Like 3 years now.
I just stopped it.
All right.
But
That's about that. That's about blood pressure. Okay, now we talked about kidney and the heart, right? You somehow skeleton talked about heart, and I was trying to ask, do we have preventive? Okay, tell us what can you advise as preventive measures to avoiding kidney
you
failure?
first of all tell the audience what kidney is. Many people don't
Yeah,
know what kidney
she
is.
has I thought she has said that already. I
No,
thought
No,
she
I
did.
we're
said
talking
they
about
have.
high blood pressure.
Okay,
Yes.
please go ahead with kidney failure. Let the
Okay.
audience know what that is about, and then
And the position where it is, like I was telling my friend yesterday, I said many people don't know the position of kidney
it,
in the body. But no,
is
it's
is
not
it on
funny,
my
but
head?
it's true.
No, 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 no. It's behind. It's this place. So yeah, kidney. Kidney is actually two. It's bean shaped like a beans. You know.
Mm-hmm.
Yeah.
So, um, the, the primary function of kidney is to regulate and balance our body pH, the water, the electrolytes. Then excretion, it eliminates waste products and toxins through the urine, even sweat. And another thing is that, hello? Okay. So this our kidney now, it has many functions, like I'm just saying now. And whatever affects it, affect those functions. So when you talk about kidney failure, it's when those kidney stops working as kidney, stop doing their functions. That's when we say that the kidney have failed. And
Yeah.
in the things that can cause kidney problem, number one is hypertension.
Yeah. Untreated
That's
hypertension.
uncontrolled
Untreated.
hypertension,
Or
uncontrolled.
uncontrolled. Uncontrolled
I wanted to say you said untreated. I know if hypertension you can only manage. I mean, when it is there, you just manage it.
but you can treat. I don't believe
But
you
you
can
can,
manage. You can
there are,
treat
yes, it depending on the cause. Like I
on
said
the cost,
earlier,
yes.
if
If it
it's
is
as
one
a
caused
result
by
of
weight,
Ah, ah.
you
So
can
it
yes,
can be
yes,
cured. Wow.
yes. When you watch
Okay.
when
your
you
weight, when you go down,
it
it will
will
go.
just disappear.
If it's as a result of all these sedentary lifestyles like smoking, alcoholism, when you stop it, after a while,
It
your
will
blood
go.
pressure will return to normal. The ones that are not
Okay.
treated is the one that is genetic.
Genetic, exactly.
You
That
just
runs in
manage
the
it.
blood in the family.
Yeah, yes. Those ones you just manage it.
You
You
just
can't treat it.
manage them.
And another one is age. The one that is caused by age. If you are going down in age and you find yourself having hypertension, that one you manage it because there's nothing you can do about it. You manage it.
Okay. Okay. Continue with
Uh,
the kidney we were talking about. Okay, you've
so I said the
tried
number
to tell
one
us
is
what it is and what causes the failure, right? Okay.
Yes.
Now, measures one can take to prevent the kidney from failing. Are there measures,
you know okay.
proven measures one can take to prevent it from failing? Or advice
Okay.
actually you could give to our audience to manage better managing their kidneys from failing?
Okay, before it gets to failing, it gives sign. There are things that happen before it gets to failing. Failing is kind of the end stage. The kidney cannot work anymore. There are conditions like acute kidney disease, chronic kidney diseases. All those stages, all those times, the kidney is still functioning, but it's not functioning as it's supposed to function. So
Mm,
once you notice that you are not feeling good, especially when it comes to urination. You know, the kidney produces urine. For example, if you are having a frequent urination and you went to the hospital and they told you, your kidney is somehow is diseased, please, okay, you need to take this drug. or if the kidney have gotten to the extent that need dialysis, you have to follow it up. You have to do exactly like that before it will get to that kidney failure. Do you understand?
Yeah.
Kidney failure is kind of end stage of it, where you have to you have to be on dialysis or you do kidney transplant. So before you get to kidney failure, you have to treat the diseases that is causing it before you get to that. So one, you have to take care of your kidney. That's the first thing. The first thing, you have to take care of your kidney by stopping. You have to stop using drugs anyhow. You have to stop using drugs anyhow, unprescribed drugs, over-the-counter drugs. Maybe you have, because it has been proven that all these non-steroidal anti-inflammatory drugs, such as ibuprofen, all those analgesics, they cause kidney damage. They cause kidney conditions. So you have to stop using them when it's not prescribed. Another thing is all these our concussions. So many bitters in the market now, and
Alomo
the rate
bitter.
people, as in so many
Odogu
bitters,
bitter.
like I'm not trying to, I'm not trying to criticize any drink, but actually these bitters are causing harm to our kidneys. It's causing harm to our kidneys.
They
In
see
fact,
it
that,
as highness. Most of our youth see it as highness.
Yeah.
and
Anything hot drinks.
And,
I said it
anything,
and
yesterday.
those
some and some and some use them as enhancement to perform sexually.
that's it now. And those things, maybe they are being produced with local herbs, eh? And that's where they will not tell you that is it not all these our local herbs, they are not synthetic and all that. But without knowing that there is no, they're supposed to have a dosage for it. And why those our what is it called? Will I say our drugs, pharmaceutical drugs have dosage, is because they have been tested on humans and on animals to know the level your kidney can tolerate. Unlike those uh, locally made drugs, all these concussion and bitters, those
Mm.
things doesn't go through any process. They are not tested. They don't even know how much your kidney, your liver, your vital organs can tolerate them. So if you actually care about your kidney, you have to do away with all these things. And you have to take water. You have to take enough water
Yeah,
and
I
be
am busy.
active as well.
I am busy.
Now, another thing is you have to avoid anything that will cause trauma to your kidney.
Such as
Yeah,
Such
such
as
as
all these waist trainers, excessively tight waist trainers, because
thank God I don't wear it.
it can prevent blood flow to those kidneys and they will be sick. It can prevent blood flow to those
For
kidneys.
me to look
So,
like a figure eight.
uh
Sorry.
but so there are so many, like, and another one is accident. Accident can cause trauma to the kidney. Understand? So
yeah.
those things, but the main thing is those drugs.
Okay.
Drugs.
I have a question.
Uh-huh.
What are the early signs of kidney problems?
Well,
The early
okay, the early
signs, like for you to know that your kidney is calling for attention.
Failing. It's failing. Not that maybe it has failed, right?
Just
not
like
that,
like
because
symptoms, early signs to show that
mm,
your kidney is calling for an attention, that something is wrong with your kidney. So what are the early signs that you will experience before you will say, okay, I need to go do kidney checkup?
okay. Number one thing is your urination. It might be frequent and it might be less.
Okay.
Another thing is you might experience swelling around your ankles, on
Okay.
your leg and your ankles. So another thing is your color. You see some of them, they will just change. Their color, they will become pale.
I think I
Then
think this I think this level you just mentioned now is actually when it is becoming chronic. Like with my recent studies, I found out that the early signs, according to what I read, it says you have most of the back pains you have is not actually normal back pain. Some of them can be a sign of
As a
kidney
result of,
problem.
yes,
But
yes, yes, you're right.
I just
A lot
heard it that you have,
of things actually, it's just
yeah.
that one, they interrelated,
You know,
All of
yeah, like you said, high blood pressure can cause it when it's not managed
controlled.
properly or controlled
Yeah.
properly. Do you know why? Because your body, if you have blood pressure, your body starts returning water. When your body starts returning water due to high blood pressure, your kidney cannot carry the weight of the excess water in your system, and thereby giving your kidney overload. Right? No, I think I'm correct, right? Because I think
To some
that's
extent.
yeah, no, that's what they told me, Yeah, I don't claim I'm not a nurse, but
Uh,
at least with the
oh,
knowledge they explain it to us, I am trying to know because as no now let me use myself as an example. Each time my blood pressure skyrockets, I'm always placed on water pills.
yeah.
And what they tell me is your body is returning water. And whereby your body is returning water and it affects your kidney. So they'll have to put you on a water pill to help release the water out of your body. Like the woman I'm taking care of, for instance, she also have the same problem. So she's always on water pill and she's hypertensive. Do you understand me? That's why I said at least body returning water can actually contribute to kidney failure or kidney problems.
Okay. In addition to that, when your blood pressure is high, this your heart supplies blood to the kidney. You understand? And the basic unit of kidney is nephrons. All those nephrons are arteries. They are small, small arteries. So due to high level, the pressure is very much. It can destroy these arteries. It can make them to be hardened. It can make them to be so weak.
Yeah.
So when the kidney is not receiving enough blood due to hardened or clotted
Mm-hmm.
arteries, it can cause kidney disease. The kidney will not function
Function.
as it's supposed to function. Do you understand?
Exactly.
So one of the function is now controlling and balancing the sodium and other electrolytes in our body, which you just mentioned. This is where the sodium and water retaining water, because
Water retention.
that retaining water means that the kidney cannot actually regulate
Let
the sodium anymore. Then this
exactly.
sodium now accumulates in the body. Instead of it will now start escaping into the outer cells where it doesn't supposed to be. So making it, you see the legs, they'll start swelling up. You see the signs all over you and all that. So that's it.
Okay, I
Hi,
have something
Chika.
to ask.
Welcome, sis.
I have
Welcome.
something to ask. I used to hear about kidney stones. At what stage can one say he's having kidney stones, or what is that kidney stone? What is it about?
Kidney stone is a different thing altogether. That's when you have stones in your kidney. When there is formation of it's kind of a crystal stones, white stones. It's not like the normal stone we know, but it's a hardened substance on your kidney. It's a different thing altogether. Okay, so it can be caused as a result of when you consume things like all these. There are some fishes that you consume, and they have. I'm trying to remember this. What they have that can now go and form that kidney stone. And another thing is when you are not taking enough water, there is every possibility of the kidney stone.
I think kidney can develop all kinds of sicknesses like kidney cancer, kidney inflammations,
There are,
kidney. There are
it's an
a lot
organ
of
now,
things
so
Yeah,
it's
a lot
prone to develop
actually.
any
can
Yeah,
illness,
generate. I
yeah.
think.
any disease.
And that
Mm.
is
So, but these
that is
kidney stones
that is
is mostly when you are not hydrated.
Exactly.
To start instead of all those things going away, going to where it's supposed to go, to start accumulating on your kidney and start forming stones, small stones. So it's a different thing altogether.
Instead of to drink water early morning, you drink shekpe. If you leave early morning water and first drink shekpe, it can cause you a kidney problem. Right? No, I think I'm right? Because imagine hot drink and water. And they said drink early morning water to keep yourself hydrated in the morning, and it will also activate your body system. And instead of you to drink that water, you would open one bottle of shekpe or alomo and quick. I wonder how they take those things. And your stomach is hot. They say, yeah, I'm feeling energetic. Now you actually killing yourself.
Of course,
That is
actually
that is that
hurting
is a
your
gateway
organs.
to your body, but it's gonna destroy you. That's
Yeah.
that's one thing I understand. So, what our nurse is telling us now is, mind what you put in your mouth, be cautious of what you eat, and at the same time, drink a lot of water to be healthy.
To be
I mean,
hydrated.
yes, no, when you are hydrated, you are healthy. Understand me, right?
Of
Yes, because
course.
when you are dehydrated, a lot of things goes wrong. Your
Yeah,
body will,
exactly.
your mouth will start
Exactly.
drying, everywhere will start drying. So the kidney will try to take water all of any place offering and okay, and it's going to cause a problem in the long
Exactly.
run. So,
All
and
right.
again, our Nigerians we are good at self-medication. We are good at that. Very, very good. We have, and we all believe that the only sickness we have in Nigeria is malaria and typhoid. If somebody will be sick, you tell the person go to hospital. The person will tell you, I will just go and buy malaria medicine. How do you know you have malaria? It's not every fever that is malaria, but they don't know that it's not every headache that is caused by malaria and typhoid. And but every time you go, they will tell you it's malaria and typhoid. You take malaria and typhoid, forgetting that those things you are treating the wrong sickness with wrong medication. It can actually cause a kidney failure, a kidney problem.
Yeah. Yeah. One
Yeah,
thing that we need to understand is that drugs, no matter the drug you use, once you don't use it rightly for the right reason, it will be a poison
exactly.
and it will
Exactly.
destroy your
And
organs.
those that drink mkpụrụ mmiri and the buzuro natukuro, it can actually destroy your
Anything,
system.
hard drugs,
Otu
alcohol.
onye si dewe bed ya ka ọ ga-esi lie on it. We
Okay.
try to we try to bring in the real thing to us. I mean myself because I'm also learning. I mean it is left for you who is listening to us to take the right decisions and make the right choices as we keep on bringing you all these things every time we get them. Thank you very much, Mrs. IJ, for being
Mrs.
here
Ice,
today with us. It would have
you
been
are the best.
with us yesterday, but we couldn't get to. Thank you for being with us today. And we promise our audience to continue with the discussion. We have two segments to this particular topic, and she will be handling the rest of it by next week, not on Sunday, Saturday. But if Saturday is not fine by us, we'll also let us know. I think Sunday is becoming I don't know, a princess. It's
Oh,
actually you that made us remove this from Saturday to Sunday.
uh,
But,
the
well,
Sunday, the Sunday thing, the timing is affecting my church program.
Okay.
that is the thing.
You know,
Aside
I'm supposed to be in church by now because I'm a singer, but I'm not in church yet.
okay,
So, and
we'll see how
I'm
it
not
goes.
going to church again today, and it's not
Please,
good.
All
So
right.
I'll be there
please,
tomorrow.
I wanna
We keep
say
a date with them
something.
on.
They want to say
Please, I
something.
want to say something before we go. You know,
Okay.
to our audience, please, high blood pressure. Before you say you have high blood pressure, make sure that you are tested. Okay, because most times once you are up to 30, please, you have to start checking your blood pressure
Yeah.
because most time it doesn't show symptom. It's when it's severe, when it's up to 180, 120, that you start experiencing dizziness,
And,
headache, blurry
and,
vision,
and
uh,
strangulation.
maybe chest pain, difficulty in breathing, and all that. That's when you now say, hey, please, once you are up to 30, even 25, start checking your blood
No, I
pressure.
want to ask you a question. Can overthinking cause high blood
Of course,
pressure?
Of course.
of course. When you are stressed mentally, it can cause it now.
If
when you are
Because I
when you
if
are
we
wanted,
if if we
arranging
leave if we leave Princess here today, we will not go.
when
If
you
we
are
but
leave
thinking that
Princess
you
here
are
today,
not
we
getting
should do it
enough.
like an hour. We're not even up to an hour because I know when we started.
we
So
are up to an hour.
no.
We're up to an hour. I just want us to keep it exciting every time we come up here so that our audience will always be glued to what we're doing so we don't lose track. Uh, on that, IJ, we'll be having you next week, Saturday, where you continue with the part 2 of our discussion today. Princess, your final words before we call it a day.
My final words is my people, my people. If it was our former governor, please, whatever you can do to keep yourself alive, do it. Whatever you can do to keep yourself going. The English people, the Igbo people say that health is wealth.
Yeah.
If you do not have your health, you cannot make money. No matter how difficult is the country, the world is turning, try and get some rest. Create that time for yourself to have some rest. If you cannot take yourself to a vacation, even in your house, take some rest, take a nap. Money can still come by if you strategize. That's all I know. But please, yes, I'm coming. All right. But please try and take care of yourself. Eat well, drink water, stop drug abuse. It's not healthy for us. It's killing a lot of young people and it's heartbreaking. Nobody's killing you. What is killing us is ignorance. When someone dies, we say, "Oh, they have killed him." Nobody kills you. Just that you are not pay. You never paid attention to your health. That's what matters.
Exactly.
That's what kills us. Please pay
Exactly.
attention to your health. Whether you are a boy, a girl, a mother, a father, take care of yourself. That's all I have to say. God bless you all.
All right. Have a wonderful evening as we catch you up next Saturday. Our guests,
And
thank you very
happy
much for being
Thursday.
here. And I believe you'll come again when we
When we
call you next week,
call you
Saturday.
Sister Jamal, please, I so much love what you do. Please follow me. I'll follow you back. You're a good nurse that talks so calmly like me, and it's good. We
See
do
how
it
she
together.
just take and slow, they dish her out.
Yeah,
Thank you
but
very much for being here today,
of
our
course.
wonderful lady. Thank you very much. We'll see you
Thank
next week.
you.
Yeah.
See you next
You're
week,
welcome.
okay?
Bye
All
bye.
right. Thank you.
Yeah, bye.
Bye.
Bye.